Imagine injuring a nerve, and instead of simply healing, the part of the nerve below the injury actually begins to break down and disappear. It sounds alarming, but this process is not a mistake. It's actually the body's natural repair strategy to give nerves a chance to regrow. Today, we're going to uncover the science behind Wallerian degeneration, what causes it, how it affects movement and sensation, and most importantly, whether nerves can recover. By the end of this video, you'll understand one of the most fascinating healing processes in the human body. What is Wallerian degeneration? Wallerian degeneration is a biological process that happens when a nerve fiber is damaged or cut. To understand this, imagine a nerve as a long electrical cable connecting the brain and spinal cord to muscles, skin, and organs. Each nerve cell has a cell body, a long extension called an axon, and a protective covering called myelin. When the axon is injured, whether from trauma, surgery, or disease, the part of the nerve separated from the cell body can no longer survive. So the body initiates a controlled breakdown of the damaged section. This process is called Wallerian degeneration, named after the scientist Augustus Waller, who first described it in the 1800s. Instead of allowing the damaged nerve segment to remain useless, the body clears it away to prepare for possible regeneration. It's similar to removing broken pieces of a road before rebuilding it. Why does this process happen? Wallerian degeneration may sound negative, but it actually plays a crucial role in healing. When a nerve is injured, the distal portion, meaning the part farther away from the brain, loses its supply of nutrients and signals. Without communication from the cell body, the nerve cannot maintain its structure. Within hours to days, the axon begins to deteriorate. The myelin sheath breaks apart. Specialized cells called macrophages clean up debris. Think of macrophages as the body's cleanup crew. They remove damaged material so that new nerve growth has space to occur. At the same time, supportive cells known as Schwann cells begin to organize pathways to guide new axon growth. So even though degeneration sounds destructive, it is actually the first step toward possible recovery. Common causes of Wallerian degeneration. Wallerian degeneration can occur in several situations where nerves are injured. Some of the most common causes include physical trauma. Car accidents, falls, or deep cuts can damage peripheral nerves. For example, hand injuries, spinal cord injuries, sports accidents, surgical procedures. Sometimes nerves may be stretched or cut during operations. Neurological diseases. Certain conditions damage nerve fibers gradually. Examples include peripheral neuropathy, multiple sclerosis, motor neuron diseases, stroke or brain injury. Damage in the brain can lead to degeneration along nerve pathways connected to affected areas. Chronic compression conditions, such as carpal tunnel syndrome, compress nerves over time, potentially triggering degeneration. Understanding the cause helps doctors predict recovery chances and select appropriate treatments. What happens step by step? Let's break down the stages of Wallerian degeneration in simple terms. Stage 1. Injury occurs. A nerve fiber is cut, crushed, or severely damaged. Communication between the nerve cell body and the distal axon stops immediately. Stage 2. Breakdown begins. Within 24 to 48 hours, the distal axon begins to fragment. The myelin sheath also starts to disintegrate. Electrical signals can no longer pass through the damaged area. This often causes symptoms such as numbness, weakness, tingling, loss of movement. Stage 3. Cleanup process. Immune cells remove damaged axon and myelin fragments. Schwann cells multiply and form tubes called regeneration pathways. These pathways help guide new nerve fibers. Stage 4. Possible regeneration. If conditions are favorable, the nerve may begin to regrow. Axons can extend approximately 1 millimeter per day in peripheral nerves. Recovery may take weeks, months, or even years, depending on injury severity. Does Wallerian degeneration happen in the brain? Yes, but the outcome is different. In the central nervous system, which includes the brain and spinal cord, regeneration is more limited. Unlike peripheral nerves, brain and spinal cord neurons face obstacles such as inhibitory molecules, scar tissue formation, limited support cells. This is why spinal cord injuries often result in long-term disability. Researchers are actively studying ways to improve nerve regrowth in the central nervous system. Advances in stem cell therapy, neuroplasticity research, and rehabilitation techniques offer hope for the future. Symptoms associated with nerve degeneration. Symptoms vary depending on which nerve is affected. Common signs include sensory changes, numbness, reduced sensitivity, burning sensations, tingling feelings often described as pins and needles, motor problems, muscle weakness, loss of coordination, paralysis in severe cases, pain. Some individuals experience neuropathic pain, which feels sharp, electric, or stabbing. Pain may persist even after the injury heals. Early diagnosis can improve outcomes. If symptoms continue for weeks after injury, medical evaluation is important. Can nerves recover after Wallerian degeneration? The honest answer is sometimes yes, sometimes no. Recovery depends on several factors. Type of nerve. Peripheral nerves have a better ability to regenerate compared to brain or spinal cord nerves. Severity of injury. A clean cut has a better chance of healing than severe crushing or tearing. Age and health. Younger individuals often recover faster. Conditions like diabetes may slow nerve healing. Time to treatment. Early intervention improves success rates. In favorable cases, nerves regrow and reconnect with muscles or sensory receptors. But regeneration is slow. Full recovery may take months or longer. Sometimes recovery is incomplete. Even partial improvement can significantly enhance quality of life. Treatments that support nerve healing. Although Wallerian degeneration is natural, certain treatments can support recovery. Physical therapy, exercises help maintain muscle strength and improve nerve signaling. Movement stimulates circulation and healing. Occupational therapy helps patients relearn daily tasks after nerve injury. Nutritional support. Vitamins essential for nerve health include vitamin B1, vitamin B6, vitamin B12, vitamin E. Balanced nutrition supports tissue repair. Pain management. Doctors may prescribe medications to reduce nerve pain. Surgery. In severe injuries, surgeons may repair or graft nerves. Emerging therapies. Scientists are studying stem cells, nerve growth factors, electrical stimulation therapies. These approaches aim to enhance regeneration. Fascinating fact about the nervous system. The nervous system is incredibly adaptable. A concept called neuroplasticity allows the brain to reorganize pathways. Even if some nerve connections are lost, others may strengthen to compensate. Rehabilitation exercises encourage the brain to form new connections. This is why consistent therapy can lead to gradual improvement. Healing is often not instant, but progress is possible. Finally, let's summarize what we learned today. Wallerian degeneration is a natural process that occurs after nerve injury. The damaged portion of the nerve breaks down to prepare for healing. Macrophages clean debris, while Schwann cells guide regeneration. Peripheral nerves have a higher chance of recovery than central nervous system nerves. Symptoms may include numbness, weakness, or pain. Treatment focuses on supporting nerve regrowth and restoring function. Recovery can take time, patience, and proper care. If you found this video helpful, make sure to subscribe to Balanced Motion Health for more clear and trustworthy medical explanations. Understanding how the body heals empowers you to make better health decisions. Leave a comment below if you'd like us to cover topics such as nerve regeneration exercises, peripheral neuropathy, brain healing after stroke, and share this video with someone who wants to better understand how the nervous system works. Your body has an incredible ability to repair itself, sometimes in ways we never imagined. Stay curious, stay healthy, and keep moving forward. See you in the next video.